Good morning, everyone. Welcome to the CMAAO meeting. This is the 56th meeting of CMAAO, and we have Dr. Chong with us from Singapore. He will chair the meeting. We don't have Dr. KK Agarwal today, but he's listening to us. We have Dr. Minakshi, we have Dr. Jamal Chaudhary, we have Dr. Akhtar, we have Dr. Mary, and we have Dr. Sanjita. And soon there will be more people who will join from the associations. Over to you, Dr. Chong.
Thank you very much for attending this. Thank you all for attending this CMAAO meeting. We are in our 50-something edition. And I'm sorry, Dr. KK Agarwal isn't here, but he's listening to us now. Can I get someone to give me an update on what's happening in India, the subcontinent, please? Does anybody have any information? If not, I will proceed to tell you what's happening in Singapore. We have some developments in Singapore as well.
So, Dr. Minakshi, can you speak about the patients you are watching and the number of patients going up and what is happening with the scenario of the COVID?
Yes, so I think we have been seeing a huge number of patients. The infectivity rate of this particular strain that we are experiencing in India at the moment is really, really high. There is if it enters to one earlier in the last wave when we were seeing patients, I think, the infectivity rate was not so high. But now when it enters a house, the entire household is infected. Not only is it more infectious, this particular strain that we are seeing right now is extremely virulent. And so, non-pulmonary symptoms are quite rare. In fact, there are a lot of patients who are coming in with non-pulmonary symptoms like diarrhea and loose stools. But on day 8 and day 9 of the illness, they are developing a pneumonia. So this is different from the last COVID wave that we had, where we had a large number of patients who were just very happy with a loss of smell and a loss of taste and just some GI symptoms. But this time around, I think the COVID pneumonia that is developing, it's in the much larger population. The severity is much more, and in fact, we've given a term of resistant pneumonia, which is not even sort of responding to the the low dose steroids and the blood thinners, and there's still the pneumonia keeps increasing, and it's just become a very difficult situation to handle. The number of cases that are coming in with hypoxia is much more than before, and so we've been talking about how the word pandemic really has lost its meaning, and it's more of a health crisis. We are in the middle of a health emergency at the moment, and it's quite abysmal, the situation right now. Dr. Chong, you tell us about how it's going in Singapore.
So I would also like to introduce, before Dr. Chong speak, I would like to introduce Dr. Monica Vasudev from US. She has been the active speaker before. And she's also the niece for Dr. KK Agarwal, and I've requested her to join on her behalf as well, on his behalf. Yeah.
Welcome, Monica. Good to see you and hear from you. We always learned so many things from your immunology input. Fantastic. I mean, I've since this crisis, I've updated my immunology so much. I always tell Dr. Agarwal that we are armchair immunologists now.
Yes. Well, we all are immunologists, and we all have to be. Yes. Thank you. I know. I hope all of you are well. I hope your families are well too.
Yeah. And coming back to, before I talk about Singapore, we just had an outbreak yesterday in Singapore yesterday. In fact, the whole thing exploded yesterday over the last 2 days. But before that, can I just ask a bit more about India? So we hear all kinds of things from the news. Is it the, which variant is it causing the problem? Is it the UK or the double variant that you all talk about?
So it's a mix of both. In fact, this is another problem that we are facing, especially in the hospitalized patients. There are multiple variants that are, prevalent at the moment. And, in fact, if I may, I've just encountered a patient who has been reinfected within 20 days. So this patient, she got well, and her CRP came back to normal, and everything was fine. And she came back home, and she met her parents, who were now again positive, and she had all the symptoms, a whole lot of new symptoms again. Her CRP rose again. So whether this was a reinfection or just, because within 3 months we never talk about a reinfection, but it looks like, the clinical picture looks very much like a reinfection. So there are multiple strains that are prevalent in the country at the moment, and that's quite scary, because especially when you admit the patients, then there are a lot of COVID patients in the ward, there are a lot of COVID patients in the ICU, and while one patient is already recovering from the COVID, so he might we don't know how the picture will be if they are infected with another strain, and whether that will be more serious or whether they'll be able to fight it off. It all depends on the patient's immune system at the moment. So yes, the double variant is prevalent, but I feel that the UK variant is also very much here.
Yeah, so I hear that it's about 50% more infectious and 60% more lethal. Is that what you guys are seeing?
Well, I wouldn't be able to comment on the numbers, but yes, we are seeing the clinical picture does look like that. When we see the patients, there are, as I said earlier, like in one household, it's really difficult to have, just one person infected, and just, it's the entire household gets infected at the same time, and it's almost maybe around 30-40% of the population, much more than that maybe, are developing the COVID pneumonia, and the pneumonia is getting very, very serious. So more than 50-60% of the lung involvement is something that's very, very common in the OPD.
What about those that have been vaccinated and children? Have you been seeing anything in those that have been vaccinated or in children?
So we had started off thinking that the vaccine is going to protect us from a very severe disease. But in a very small percent of the cases, we are seeing that people who have had full immunization, even they are landing up with a pneumonia, maybe not as severe. And we're seeing the other picture as well. There are a lot of people who have received the full dose of immunization, and then they are not they're not developing a very severe disease, and they're just sort of breezing through it with just a cold and maybe a mild cough. But there is a very small percentage of people who are developing a serious disease even in spite of the infection. So this might be due to the other strain, and the strain that they're not immunized with. So this is a challenge in the coming times, I feel.
What about children, Dr. Meenakshi?
Children, yes. So we are also seeing an increased severity in the children. There are a lot of people, but of course, in the children, we have yet not seen in the last, huge number of patients that we've seen. We've not seen any patient getting the multisystemic disease that's always feared. That's still not there here, and we are yet to see a case like that. But yes, the children in the last wave, so I'm always comparing with the previous wave. So in the last wave, we were not seeing a lot of children getting a fever of 101, 102 degrees Fahrenheit. But in this wave, we are seeing, so as I said, the entire household is infected at the same time, and so are the children. The children, although they do get better soon, they get better in 2 to 3 days, but they are infected, they are showing symptoms, and they are developing high-grade fever.
Okay, thank you very much. Okay, I'll just go on to tell you what's happening in Singapore. So as of just 2 days, just in the last 48 hours, we've had an explosion of cases here. To date, we have suddenly had 9 clusters, including one of them affecting one of our biggest acute hospitals called the Tan Tock Seng Hospital. And that's a big challenge because it's one of the busiest hospitals in the country. And to date, we have 13 persons, 2 doctors, 2 nurses, 1 cleaner, and 8 patients who have developed who have caught the COVID infection in the hospital. So we have had to lock down the hospital as well as lock down 4 wards, so patients can't go in and out. And fortunately, next door is our state-of-the-art center called NCID that we built in 2019. In 2019. And so most of these COVID patients are being transferred there and taken care of. But it was to our shock and surprise on Wednesday early morning that the doctors of the hospital were ordered to come back to the hospital at 4 a.m. in the morning to be swabbed. The entire hospital, all the doctors to be swabbed. At 5 a.m., the nurses to be swabbed, and then so on. So it was quite a challenging time for us because throughout the whole COVID crisis, we never had one of our big hospitals infected. And this is, mind you, with doctors and nurses all fully vaccinated with the Pfizer vaccine. So this is very unsettling for us. The other big cluster we have is our immigration officer, border control guys. So there's another cluster where there is a immigration officer who is infected, and he's infected all his family members, and he was working at the Singapore Changi Airport. So that was another big cluster, so 8 of them there. We had, unfortunately, one gentleman from India visiting his son here, because I think we have quite a big diaspora from India here. And he came and infected his son and 2 other persons. Our dormitories, we had about 7 cases appeared in one of the dormitories. And that one, the latest news from there is that it looks like most of them are shedding fragments. They're not really infected. So they're just shedding fragments. Most of our dormitory workers who have not been infected first time around have been vaccinated as well with Pfizer or Moderna. So we've taken quite good care of our dormitory workers, our migrant workers, but nevertheless, the challenge is still there. There was another couple of cases where there was an accountant, unfortunately also of Indian origin, and she has infected 2 other persons. Another Indian national working at our university, and we had also infected 3 persons. We had a person from Papua New Guinea infected 4 persons. And one of our Vietnamese staff working in Singapore, she works as a cleaner in one of our community confinement centers, where we put all the people who are getting better and getting well. And she's in full PPE and she caught the disease. So she spread to another of her family members. So all in all, suddenly, out of nowhere, in 48 hours, we have 9 clusters, small little clusters they may be, but we're very, very challenged at the moment. And there's one gentleman who's studying at our NUS here. He's also from India, and he is a community case. We have no links to where he caught the disease. But having said that, we also have information on the different variants in Singapore. Our imported cases, we have 155 of the UK variants. 7 were in the community. The South African, we have 130 cases imported. 1 was found in the community. And the Brazilian and the Indian variants have not been found in the community so far. We have had imported cases, but we have not found any in the community. So we have 1 South African strain in the community. We have 7 UK strain in the community so far. This is the latest data. But again, we have just swapped 5,000 people in the hospital. So we're waiting for that to come back, for all the sequencing and the data to come back. Now, we've started a little, not a full lockdown, but we started a mini lockdown. So all the locations where these cases have been asked to close for 2 days for a deep cleaning, clean the whole place, including some malls, shops, even mosques, because they've visited mosques and so on. We've closed about 20 locations for deep cleaning. And we hope to get on top of it. And one of the interesting things is, fortunately for us, or one of the bright parts for us, is that we have this Trace Together app. And this Trace Together app, you can see, is about 85% of the population, that is 4.7 million of us, have this app. And it's doing Bluetooth exchanges with other phones. So for example, you can see that from my phone that I've done 1,000 Bluetooth exchanges with other people yesterday. And some days it can go up to as many as 3,000 to 4,000 Bluetooth exchanges. So this Trace Together app has been tremendously helpful when it came to contact tracing. For people who are not tech savvy, we make them wear a token, especially the elderly. And these also carry out Bluetooth exchanges with other tokens and other phones. So we hope from our in IT, with 85% of the population doing this, having these apps and tokens, we hope to be able to ring fence the situation as soon as possible. Of course, we'll know in the next 1 week whether we have bigger explosion of community cases. That, needless to say, we now have thousands of people in quarantine because of to ring fence these clusters. So that's where we are in Singapore. Unfortunately, I think as expected, these were all from border controls, and somehow, as you've rightly pointed out, the strains are more virulent, more lethal, more infectious, and somehow our border controls have just kind of let one or two through. So we've also tightened up our border controls significantly as of the last 48 hours. So we'll see how things go, but in a good way, Singapore is small, so we can concentrate a lot of efforts in areas that bring resources to bear. Whereas big countries like India, I mean, the scale is of a completely different order. So we also appreciate the difficulties you're going through. I understand the Singapore government has sent a shipment of oxygen tanks as well, or whatever, oxygen plants or something. So I see that help is coming from all over the world, including the Indian diaspora in the United States and so on. So this is a time where we all really have to pull together and beat back this massive second, third, fourth, whatever wave, that we're seeing. And I'd like now to ask Dr. Chowdhury whether he can update me on what's happening in Bangladesh.
Yeah, thank you very much, Dr. Chong. Good morning, everybody. Actually, I'm very much anxious, first of all, hearing that our president has got infected, actually, even after a double dose of vaccination. So I wish him early recovery and without sequelae. Actually, I hope, because he has been vaccinated, so it should not go far. So really, really, I'm sorry. Actually, so Dr. Chong, I also request you to keep yourself safe. Actually, really hearing all this sad news, actually, feeling fine, actually, I'm telling you one thing. So I have also taken the vaccination, actually, 2 doses, actually. So I try to maintain that, actually, we go every day in the lot of places, actually, with big people. So anyhow, so in Bangladesh, actually, the situation is just getting better, I must say, because, a few days back, actually, it was going too high. So we are anxious, actually, because now I asked our IEDC who was doing the genome sequencing, and they were telling me it is 35% is having the South African variant here, according to their calculation and their sequencing. So, and in another study, it was higher, but the thing I think is official, it's 35%, must agree on that. So, and Bangladesh is now under lockdown. Actually, it was a strict lockdown 2 weeks, actually, must say. And later, not 2 weeks, it's 12 days probably, because of the pressure. Bangladesh cannot withstand all the things, actually. Government cannot withstand, because there's a question of living and life. And so question is there. There should be balancing there because of the financial considerations. So our shops are open, but you have to, I have seen better management there regarding the mask, wearing mask and the social distancing. It's better. I must not say that it's absolute. So we are worried about that also. And so, because there is some festival, this greatest festival of the Muslim communities here. So it's Eid al-Fitr coming up someday. So the shops are open. And in the streets, the vehicles are moving, but sometimes they are controlled by the police. So anyhow, I hope it's coming up. It's coming down. Near about it was 7,600 some days infection per day. Now it is hovering around 2,000 like that. So still it is there. We are worried. I don't know whether we are worried, especially because of the variant, double variant in India. So Bangladesh has this closed this border. So even then we are expecting some entrant. We are expecting anyhow. Probably there may be control. I must say the government is aware of that. So it's like that. However, Singapore, actually, what is the total number of infections, Dr. Chong? Total number of infections, you're saying? Total number?
Total number is, let me do a quick calculation. So far in the last 48 hours, we've ended up having, hang on, just give me a quick, I think it's about 70, 80 cases just suddenly in the last, or maybe, sorry, less than that. We will have about maybe, sorry, about 50 cases in the last 48 hours that have just appeared in 9 clusters. So we're very concerned. Previously, you know, for the last 4 to 5 weeks, we've had like 0 to 1 case every day, you know. So suddenly we have about 50, 60 cases. It's quite a rude shock, you know. But our resources have come to bear on these 50, 60 cases, ring fence all of them quickly, use our Trace Together app, our tokens, try to get them all, you know, ring fence, quarantine the contacts, and then massive swabbing going on. We just swabbed, I just think I just told you, we just swabbed 5,000 nurses and hospital and doctors in the hospital. By the way, the Tan Tock Seng Hospital is next to my hospital. So we're all a little bit worried, you know, honestly.
What about the sequencing, actually? Genome sequencing you have done?
Sorry?
Sequencing.
Oh yeah, we're waiting for all the sequencing to come out. It's taking some time, but we'll have some pictures soon. So hopefully in the next roundup next Saturday, I'll be able to tell you what's going on. But so far, what we know is we have 7 cases of the UK strain in the community, 1 case of the South African strain in the community, but no Indian double variant variant at the moment, and no Brazilian variant at the moment in the community. But of course, imported cases we have all of them. Because they come in, we have.
Dr. Chung, I must ask you about the things actually which you have uploaded in the CMAAO this site. That about your study regarding the hydroxychloroquine and the ivermectin. You have shown there. So that has to be discussed because, you know, in Bangladesh we are concerned more patients are coming up to the National Guideline Committee to include ivermectin in their protocol, but we are not agreeing it. I am one of the members of that guideline committee, technical guideline committee. So we are not allowing it. But anyhow, we are getting pressure from outside sources actually. So I want to know about that also because I have not seen much difference there. We have seen difference, but not much difference, which must be actually this year. That also has to be actually discussed better because I must get some information from you more. Thank you.
Yeah, so our study here is very interesting. I think it was just published, and I think I sent a link to everyone on the group chat. 3,000 asymptomatic patients. These were mainly migrant workers in our dormitories. So they were all seronegative to SARS, and follow-up was 99.6%. Very good. Follow-up was very good. And compared with placebo, vitamin C, the risk reductions were quite significant. So for example, for hydroxychloroquine, the risk reduction was 21%, confidence interval 2 to 42, and povidone iodine throat spray 24%, 7 to 39% interval, and there was no significant differences observed with oral zinc, vitamin C, ivermectin, but with hydroxychloroquine and with povidone iodine throat spray, there was a statistically significant reduction in risk. Perhaps I'll get Monica to talk to us about this, what she thinks. Monica, can I have your views?
Yes, so what we're seeing right now is that the use of any sort of medication regimen is unknown because everything that we knew about these medications were with respect to a certain variant in a certain time period along the course. So whatever we know does not apply to today. And I feel right now with the potpourri of medication and the especially this intense effort to get medications is very, I think the yield is very low for the amount of effort that's going in to gather these medications. For example, we had the monoclonal antibody bamlanivimab that was available for patients who were low risk, outpatient infusions, who are not hospitalized. This just lost EUA authorization in the US because it found it conferred no benefit in the situation of variants. So as this virus changes, as the variants changes, the medications that we hear about, they did not necessarily stand up in the original studies, but were used out of, last-ditch efforts to be able to treat. Oxygen, anticoagulation, systemic steroids, rest, proning. These are the most important things that we need access to. Everything else that we talk about, I think, is a risk-benefit ratio. Where are you along the course of your infection? What is your oxygenation level? Can you manage at home? And I think the most critical thing is not to infect the people that are around you. And in terms of vaccinations, we are seeing that people are getting infected with vaccinations. There was this culture, this thought process, if I get vaccinated, I will not get sick. That was not the intention at all. If you go back to the original publications, the primary endpoints of all these publications was to prevent severe disease or hospitalizations. And I think we're forgetting what the primary endpoints of all of our things are, especially in the current fear. The world is stunned. We're calling it an apocalyptic surge that you're having in India. And what India is teaching us is that we cannot let our guard down, right? That variant will escape. We will relax our social distancing. They just allowed now unmasking in public outdoor places in the US. So we feel that this escape can happen anywhere. But what is the bottom line? Bottom line is we have to do the common things first. Stay well, stay less stressed, stay hydrated, don't infect other people. But going after all these new therapies, all these antiretrovirals, antiparasitics, anti-everything, I don't know how much help they confer. And I don't think it's worth the effort, because I think even in the effort of procuring all of these agents, we're gonna get sick and we're gonna get others to get sick. I know it's a kind of a very philosophical approach that I'm giving all of you, and I'm not talking about a specific medication, but I just feel that we need to go back to common sense. This is where we need to be.
Thank you, Monica. I understand where you're coming from. It's back to basics. That's what you're saying. Good public health, etc. Common sense, social distancing, hygiene, keeping yourself healthy. Yes, I understand where you're coming from. But very often we see that there's a big demand for polypharmacy or for doctors because they feel rather helpless and they want to be able to prescribe something to patients. So I also understand where that is coming from.
Dr. Chou, can I just ask a question to Dr. Monica? Dr. Monica, so please, could you explain actually what is the reason behind in USA, still we're seeing this number of infections in near about 60,000, 56, 60,000 like that. If you compare it to the population ratio, then it's high still. And then you have already vaccinated more than 20% people. So what is the reason behind it actually? You have just now the new administration is working, and why the infection is not getting down in the US?
Yes. Okay. So that's assuming that everybody has the same risk factors for infections, right? People are getting infected because they were social distancing before, and now they're feeling relaxed that the infection rate is low. So they're doing more things. They're saying, oh, the world is vaccinated now. I can now go and do a birthday party. I can do a wedding. I can do, this is why the infections are happening, is now that you have these people who are susceptible to infection are putting themselves in scenarios that they didn't before. Yeah. And I think it is very difficult. We have to live life. People are living hand to mouth. If they're not going to work, they're not doing their businesses, they're not taking care of the elderly, families have been separated for so long. I think the world is experiencing pandemic fatigue, and it's changing the behavior. You have pandemic fatigue, you have vaccinations, and they say, Chalo, I can go, I can do my things now. And the people who are getting vaccinated are getting sick. Not everybody is getting vaccinated, and not everybody is getting sick. So I think this is why the numbers are still there, and people are having huge rallies, like people are getting together. It's not the same like it is in India, because I think that there's so much space. I think that the demographic, the genetics is different. You have a much different heterogeneous genetic background. And I think that maybe the clusters are going to happen where you have airports. Look at what's happening in Ontario, right? They saw that all the variants that are coming when they're doing the genetic surveillance in Ontario is showing that they're from India. So now what have they done? They shut down all the flights. They've shut down the whole province. Nobody can do anything right now. Their ICUs are full in Toronto. So if it can happen in India, it can be brought to Ontario. It can happen to the rest of the world. So I actually think, why isn't it even more here? Because we are much more relaxed as opposed to why are we still having numbers? I'm like, well, maybe the situation should be that maybe there should be more numbers and we're not seeing them.
Yeah. Thank you, Monica. I and Dr. Chaudhary, I agree. I think in Singapore, for example, we've vaccinated more than 2.2 million doses to date. About 850,000 have received both doses. So there was a kind of a atmosphere that things are going back to normal, and that's why. But we still do not allow anybody more than a group of 8 to come together for dinner, for example, in a restaurant. But even then, it used to be 5, now it's 8. But even then, it's some relaxation. So now we've tightened the rules up again and telling everybody, please do not do this every day. Party of 8 every day, and so on. So anyway, I'd like to hear from Alvin about what's happening in Hong Kong. You've heard pretty much what's happening in Bangladesh, in India, Singapore. Can you tell me what's happening on your part of the world?
Yeah, thank you. Well, first of all, I have been paying attention to what's happening all over the world. And in fact, even I remember a few weeks ago when USA were having a little bit rebound of the cases because almost half of the population had been vaccinated. And at that time, the authority, the person reporting in the news said that she was very worried at that time. Of course, luckily, USA now did not really go even much worse after that episode. So I think different places could not, the people could not be complacent really because of the doses vaccinated and also for the history that had been seemed that the control had been quite satisfactory. So in Hong Kong, the same thing also happened. We had only single-digit confirmed cases for the past 2 or 3 weeks, in fact. And yet, of course, the problem is the border. So I think similar to Singapore, we had in the past 2 or 3 months, about 100 cases of imported cases of variants. So majority being UK variants, and then minority being the South African variants, also very few Brazilian. But unfortunately and ominously, for the past week, we have a few cases of the South African variant and also Indian variants detected in the community. My goodness.
Oh,
so just 1 or 2, but that is ominous enough. Because out of the blue, as in Singapore, we had 1 or 2 cases of the Indian variant with the 484 and then the 452, right? And then we don't know where it's from. And then it's detected on a Filipino helper. And the Filipino helper had infected the baby that she had been nursing. That just occurred a few days ago. So we are very, very scared. In fact, the government immediately ordered that all helpers, domestic helpers, there were altogether 370,000 domestic helpers in Hong Kong, all have to be tested unless they had been vaccinated for double doses 14 days after the second dose. And so the first step is that they would ask every domestic helper on renewal of the contract on renewal of the contract or new contracts, they must be vaccinated as well. So, but of course, many domestic helpers organization, self-help groups, and the families that are employing domestic helpers had a lot of complaints and then requests that ask the government to do more. That is, if they really ask for some control measure, the government should give, subsidy or subsidize the families to give the domestic helpers that are coming to Hong Kong to have the free vaccination in the Philippines. That is, the government should pay the bill. Now, of course, these are always the struggles between the government and the industry as well, and also the recipients of the service. So, however, for doctors, still we have not yet have any hospital spread cases. So we have to understand more about the outbreak in Singapore so that we could prevent such a thing to occur in Hong Kong. So I'd like to ask the chairman, in Singapore, so you said they would now upgrade the border control. So what measures have been implemented to upgrade the border control?
Okay, so first of all, what they did was they increased the quarantine period to 21 days for quite a number of destinations. And I'm sorry that I'm also sorry to tell you that we've banned all passengers coming from the subcontinent for the time being, unfortunately, because of the massive numbers. So this is what we've been doing. And I think the other country that's also we've also increased border controls is with Thailand, because there's some stuff going on there as well. So unfortunately, this is the situation here. We're a small city, really. We don't have a big hinterland, so we need to open up our economy. So that's the imperative. The economy imperative versus public health, always a struggle. But obviously at this point in time, we have no choice because suddenly the numbers have just appeared. Now, I'd like to listen to what's happening in Malaysia. So that's Ravi, and then followed by Angelique, what's happening in South Africa, and then Marie, what's happening in Japan. Ravi, if you may.
Hi, Chairman. Well, in Malaysia, what's happening is we're having the fourth wave now. Cases are increasing now. As of yesterday, we had about 3,788 cases. Life is actually back to normal in this country. I mean, businesses are open. Of course, they have got the SOP, not more than 4 to a table for dinner, and the bigger tables maybe 6 or 7. But unfortunately, because this is the fasting month, the month of Ramadan, we have what you call this bazaar Ramadans in the evening, where they go and buy their food to break their fast. And that is one of the areas where people are not following the SOP. And so the cases have started shooting up. They have not found any variants from India as such. At the moment, I think they've got a variant. UK variants have been detected in Malaysia. Border controls are still very tight. The part where vaccination is, I think more than 1.5 million citizens have been vaccinated. I myself have got my second vaccination, and that was Pfizer. As of 26th of this month, they have gone into phase B, which means they're going on to the public. All this while it was the first liners, now is the public, starting off with those above 70, and they're coming down. But unfortunately, the government, of course, is asking us to follow the SOP. You wear a face mask, make sure you wash your hands, and avoid crowds and all. They allow weddings with strict SOPs, maybe only 20 people, 30 people maximum, and depending on the size of the hall and all those kind. Prayers, of course, they have got SOPs, but as you know, human beings, many people do not follow the SOP, and that is the sad part of it, and that's why the cases are increasing. Well, I think I share my concern with Singapore as well. I think Thailand is also increasing. And like Monica said, this is something we are fighting against, not knowing what the next move is by this virus. So that's for Malaysia.
Thank you, Ravi. And we are always humble in our fight against disease. It's so humbling, so humbling. Can I hear from Angelique from South Africa, please? Angelique, are you there?
Yes, I'm here, just trying to unmute myself. Morning to everyone. From SAMA side, what we have seen, there's a very slight tendency of increasing of our numbers. I think we're going to go forward, maybe starting with our third wave. I might be wrong. I might be totally wrong, but the figures are not going. We haven't seen any figures under 1,000, and yesterday it was 1,600. But again, as I've said before, our numbers are not very reliable always, so it might be higher. And yes, it's difficult. The real sick patients are easy to identify in a clinical setup. It's the ones that's got mild disease. And now we're starting with our winter season. So it's difficult to distinguish between mild disease of COVID and the common flu or cold. But for now, the ones that sick are really sick. We admit them. And that's about where we are. I don't have a lot of more information because it's still sort of the same every day. But I think our numbers is slowly going up. I'm not sure whether this helps you guys.
Thank you, Angelique. And I hope you found the study that we did in Singapore useful on the Ivamectin, on the hydroxychloroquine and the throat spray. Marie, do you have anything to update us from Japan?
Yes, we are experiencing the fourth wave right now, and only 1% of the population have been vaccinated. And we detected 40 cases of Indian mutant at the airport and one in community. We are pretty much afraid of that. But the Nagasaki University announced that they are now trying to use the anti-malarial drug called 5-ALA is quite effective to both the mutant and the COVID-19. So I'm going to share the in vitro paper, but they are now trying the clinical trial right now. And they are saying that it's quite effective. And I can report if I can get more results from them. Thank you.
Thank you, Marie. And have we heard from Dr. Pillai? Dr. Pillai, are you there?
Yeah, he's just unmuting himself.
Oh, okay.
We also have Dr. Mithai Pillai and Dr. Prakash here.
Yes, can we have them update us as well? Thank you.
Dr. Pillai, if you could just unmute yourself.
Dr. Martinda Pillai, are you there? Dr. Prakash?
Yeah, Dr. Prakash is here.
Yeah. Can you hear me, Dr. Pillai?
Yes, we can hear you.
Yes,
yeah.
we
So
can.
the situation in India is very grave. Almost more than 4 lakhs this is shooting up, and the test costs are more, and doubling time, which used to be 28, now it is almost 10 days or even less. And because of the sudden increase in the number of cases, we have problem with oxygen shortage, remdesivir, which again is not freely available. But then that is not a major issue. But oxygen supply, we are coping up, and we are almost sort of getting over the crisis. And so Oh, the variants, of course, the UK variant, African and Brazil variants are there, and Indian mutants, double mutant is also there. But whether they are much more fatal than the previous one, the studies has not definitely put it so far. But then what we see is a sudden crash of the patient. Hypoxia, even the stage of hypoxia, we are not able to detect even before that patient crash. And such cases definitely are much more in number. But whether the mutants are much more lethal or not, our studies are yet to come. Small studies conducted show that it is not much lethal. But then the spread is definitely much more. The RO factor or not factor, which is now almost 4 or 5. That means one person is infecting at least 5 other persons, which definitely may be because of the variants. And our whole nation is on a war footing to contain it. And immunization programs, again, is going on, but vaccine shortage is there. But vaccine shortage within a week, we may be able to overcome that. So India is on a high alert, and the situation is getting under control. Hopefully, we can sort of contain the spread of infection. Thank you.
Thank you, Dr. Pillai. Sorry to hear about this. Yes, Dr. Chaudhary. Yes.
Can I just have a question for Dr. Mathanda Pillai? Actually, yesterday, probably yesterday, I've seen you, Union Health Minister just announced a new protocol for the treatment of the COVID-19. And he has included Ivamectin. Is there any research on it in India? Dr. Pillai?
Dr. Prakash?
Dr. Pillai is here. Is unmuted.
Okay.
Dr. Pillai, if you could just unmute yourself. Dr. Pillai, are you here?
Or maybe we can get Dr. Prakash to answer.
No, Dr. Prakash is from Nepal.
Oh, sorry. Sorry, my apologies.
And all the participants.
Okay, Dr. Prakash, would you like to answer? Would you like to tell us what's happening? Sorry about that. Made a mistake. Do you have anything to tell us?
And all the participants, good morning. Yeah, we are in the running short of time. That's why just briefly I will tell. Because of the open borders with India, we are also almost facing the problem as in India, because in our country also in random sampling we got the UK variant, double mutant also, and triple mutant also very few, and most of the infrastructure are not sufficient to cope this epidemic, and we are trying to make the temporary hospital also, and some isolation center in front of hospital with tent also, and the logistic supply till now is not so bad. It's almost we can cope with 1 month, I think. And the infection is so vigorously increasing, because 2 weeks before the infection number was in single digit, and last week became the double to triple digit, and now it is in 4 digit. That's why we are praying with gods, and we are doing our best to cope this epidemic. Thank you.
Thank you, Dr. Prakash. Monica, do you have anything else to tell us? I saw you just posted something about ivermectin. Do you have anything else to tell us?
No, it's along the same lines that we are not using ivermectin at all. Again, risk-benefit ratio, we do not feel that ivermectin confers any benefit in use. And so just reiterate that I posted a couple of links to a Twitter feed by an infectious disease consultant that was a former colleague of ours, brilliant woman. She's in the I believe she's in the San Francisco Bay Area. And it's given some graphics. It's very nice. It's given both. I've given it in English and in Hindi, where you can see what the mainstays of treatment are if your oxygen levels are fine or if your oxygen levels are low. And again, there's no mention about ivermectin in any of these graphics, again, to help. Again, you do not want, when you are sick, when your systems are compromised, your kidneys are not working, you're procoagulant, and then you add on a medicine that may give you additional side effects. So no ivermectin.
Okay, Monica, can I just ask you while we just mentioned it about thrombosis? What's the situation on the vaccines and the sagittal thrombosis, sagittal vein thrombosis?
So this is a very unusual side effect, and it's in locations, splenic circulation, cavernous venous. And so the direction at least came from the Johnson & Johnson vaccine, which was the single dose vector-based vaccine. This was not the mRNA vaccine. And the reason that there was a pause in terms of the immunizations was to be able to educate those to say that if you had symptoms that we're not using anticoagulation in these individuals. And so the big picture view is that your risk from clots is much higher with oral contraceptive use, from smoking in the general population than it is from the immunization, so that the risk is very, very low. But to recognize that if you do have symptoms, that they should be treated not with anticoagulation and they should be recognized. So there is no contraindication with the history of blood clots to be able to get the immunization, because we feel that the risk is not no immunization or immunization. The risk is getting the infection or getting the immunization. That is what we need to compare. And the risk for clots much higher with infection.
Yeah, even within Singapore, we have a lot of vaccine hesitancy because of this recent outbreak that we just had in the last 48 hours. We have people asking, it looks like vaccination is not helping, So of course, there's a lot of vaccine hesitancy, and all the press on the J&J and the AZ vaccine causing this CSVT. So it's not really helping very much in terms of vaccine hesitancy in Singapore as well. There's a lot of confusion. Patients are asking. So there's a lot of reassurance by the government on, by the ministers and the government on this matter. So just thought I want to touch base with you on that matter. All right. Is there anybody else that we haven't heard from today?
I see a new name. I'm not sure if it's a CMAAO person. It's Tejo Yaswin. Can you please identify yourself? Are you from the Medical Association?
He's from Bhutan, probably. He's probably from Bhutan.
Oh.
Tejo, can we have a word from you as well?
Oh, he's just told us he's not from the Medical Association.
Oh, is it? Okay.
Yeah, he just told us on
Dr. Monica, can you just tell me about this circulation from the DC, USA, that they are telling that if you are vaccinated properly, then you don't need to use mask. Is it true?
Yes. So the guidance is that if you have vaccinated people, you can create clusters of environments where you do not need to mask in indoor environments. Yes. However, that is what is being said. And I think what it's doing is it encouraging people to get vaccinated and they stay in their cluster of families. But I don't think people are necessarily wholeheartedly going out unless they already were. I don't know how much the change in behavior is because of that directive. There are people who were going outside unmasked even before CDC said to do it. So I don't know how much the guidelines are actually playing a role. I think those who are conservative, those who are safe are staying safe. Those who are willing to take the risk are willing to take the risk. But yes, there is that. But so for example, when I'm working at work and say my clinical team is all vaccinated, we're all still wearing masks with each other. We're not saying that it's okay for us to be unmasked. So just because the guidance comes doesn't mean that we're all following the guidance,
Yes.
right? To the point of being more conservative, right?
I think in Singapore, one of the things we recognize is that when you're having meals together, it seems to be quite a fairly risky thing. So our directives, for example, within the clinic is that even if you're having meals together, try to not to have too many people, because everybody's off their masks eating together, you know, as you know what, in a pantry or something. So there's actually a lot of guidance on this area. We recognize the fact that being together and eating together, it can be quite close proximity, and may end up endangering everyone. So actually, we've come to the end of our 1 hour session, and you know,
I see. I'm sorry. I see Dr. Akhtar Hussain has raised his hand. Maybe he wants
is
to
that
have
right? Okay, yes. Can we please have a word from
Dr.
Dr.
Akhtar Hussain is, I think, from South Africa.
Thank you. Thank you,
Yes.
Chair.
Yes.
I just like to know, is India seeing the peak or any plateau or anything curve is bending? Is there any information on that?
So if I may,
yeah.
Yes, I don't think we have reached the peak yet. There's no sign of a plateau. The cases are rising at the moment, but hopefully, it will be we will reach the peak soon, and it'll just start going down. But as of now, no, we've not reached the peak. There's no plateau in sight, and yeah,
I want to add here, I was just reading an article on the Business News, and it says that India will not reach the peak until June. So we're still a long way to go, and I'm not sure how many.
The cases are just rising every day right now, and as I said, it's all because of the increased infectivity, and the situation is quite bad as of now. But yeah, I think with Dr. K.K. Agarwal's awareness, I just believe that if we start early treatment, we can just reduce the numbers that are we're losing, the lives that we're losing. And infection, that's not something that I don't know how much the masking and the social distancing is helping with, because you just mentioned, Dr. Chong, that there was someone who was in a full PPE kit and even she contracted the infection. So, well, the infection is here to stay, but the mortality, I think that we can control with early treatment.
Yes. Thank you very much. And it's disturbing to hear this sort of news that it won't peak till June. I mean, a lot of the Southeast Asian countries share a lot of diaspora with the subcontinent. So we feel very 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 sad that this has happened. And in particular, it's nothing hits home when a person is down with it. Like our president. So our thoughts and prayers are with our president. And, I hope you guys look after him very, very well, please. Thank you. We hope to see him back with us ASAP as soon as possible. Whatever help we can assist, we're doing our best over, here in Singapore, if we can, anything else we can help him with. We've come to the end of our 1 hour. So without much ado, and thank you everyone for attending. And, especially Monica, I think it's middle of the night somewhere over there. So, and for Angelique as well, it's quite an unearthly hour. So thank you all for joining us today. And, it's always such a pleasure to listen to everybody, although today a little bit of different circumstances, a bit of shadow hanging over our heads. But our thoughts and prayers are with our president. And thank you everyone for tuning in again. And we hope to see everybody next week. And I want to see President back in his usual spot next week, as much as possible. Thank you all, and Godspeed, and be safe, everyone. And thank you so much.
Thank you.
Thank you, Dr. Chong.
Thank you very much.
Thank you.
Thank you.
Next week.
Get well soon.